is Donna Brown. Today I am going to be showing a behavioral assessment. It's a risk and harm assessment. In the name of that assessment is the locus, which is the level of care for psychiatric and addiction services. And what that does is it assesses for risk and risk of harm in psychiatric needs, also risky behaviors through addiction. In that, it assesses the level of functioning that a person would have, and also the level of supports they would have. And I see this assessment as a really beneficial tool. It can be standardized through an agency. You go through and you go through each category, their risk of harm, their level of functioning, medical or psychiatric or addiction co-occurring disorders. For myself, I would see that in this assessment, the locus, that it does cover both psychiatric and addiction, and so it gives you a great insight as to what is going on with a person. Also, it can be standardized through what a great strength that utilizing this is. It is a standardized tool that is often used through a full agency, and if all departments within that agency are using the same tool, and also in the network of care, say you're using it for your psychiatric and your addiction, and so if everybody is using the same wording, everybody's using the same testing, then you have a great understanding of where, when the person is scored, of where they're going to fall in and what needs they need and what supports they need. Also, within the network of care, say if their doctor's office is using the same tool with a person and they want to refer somebody to you, they can say this is where this person is assessing at through the locus level of care. And it does separate out different levels of care that a person may need, which is a great strength. Let's say if somebody scores at a basic level, then they just need community supports. But if somebody's scoring, say, at an 18.5, that's where they would need hospitalization or residential treatment care for addiction. So I thought that it would be a good opportunity to show how you would work with a locus with a person. And I do want to back up just a moment and say the weaknesses for myself that I see within this behavioral assessment is that when you are scoring it, if the person does not document, say somebody had a locus of a level of care of need as 5, and so they didn't document and say that this is a level of care of need of 5 due to lack of supports and their addiction, then that would be a residential treatment. If you didn't specify on that, and you put level of care 5, and so then they think, oh wow, this person needs to be in a psychiatric hospital. Those are two different levels of care, because a level of 5 psychiatric would probably be a locked facility where the person did not meet standards to be able to be seen in an outpatient or even a social model support system. So with that, I'm going to proceed. So this is the locus assessment, behavioral assessment with Dylan. Dylan has given her consent for us to do this assessment. She does understand our safety needs as far as in the times that that we would have to do reporting, and that would be in any time that she mentioned that she did want to do self-harm. I would have to notify the appropriate agencies, or if she was wanting to harm somebody else, I would have to notify the appropriate agency. And also if child abuse or elder abuse was happening, I would have to notify the appropriate agencies, and Dylan has a good knowledge and understanding of what that means, right, Dylan?
Correct.
Okay. She also does give me consent to release this video to my class, correct? Okay, thank you for that. So Dylan, what we're going to do is we're going to be doing a behavioral assessment. It's just going to look at your what behaviors and what level of functioning you have right now, and to see if there are any supports or if how your functioning is currently. Okay, so first we're going to go through the risk of harm, and in the risk of harm, I'm going to ask you, you know, we have gathered a little bit of information, and you have told me that you've not had suicidal thoughts or no
Correct.
impulses. Okay, so when I go through this, if you could just answer and let me know where you fit in, and if I'm going to ask you just little pieces, okay? We do have a little bit of background information from our initial assessment. So you have told me that there is no risk of harm. So under risk of harm, you're going to tell me, or we're going to put you down as a 1. And under that would be minimal risk, no indication of suicidal or homicidal thoughts, correct?
Correct.
Okay. And then our next one would be our functional status. And in the functional status, we're going to go through and I'm going to ask you where you fit, and you're going to tell me yes or no, okay, and how your functioning's going. So we know just by you being here today that it's not that there's absolutely no functioning problem, that there is a little bit of a problem or you wouldn't be here today. So we're not going to go to minimal impairment. I'm going to go through the mild impairment at first, and I'm going to read it to you, and you're going to tell me which one of these categories you see life fitting in. If it doesn't fit in there, we'll move on to the next one. And sometimes even if it does fit into that category, I might go on to the next one just to make sure that it's not the following category, okay? So in the mild impairment, it says experiencing some problem or interpersonal interactions with irritability or increased irritability and hostility or conflict, but you're able to maintain your relationships and keep all your satisfying relationships. Would you say that that's true?
Yes.
Okay. Recent experience of minor disruption in self-care or usual activities. Are you getting up and showering like you usually do? Or you know, wanting to get up and participate in the day, or kind of not?
It takes me a while.
It takes you a while?
Mm-hmm.
And so in it takes me a while, that means that like you gotta make yourself get up out of bed. You don't want to get out of bed.
Don't feel like it.
You don't feel like getting out of bed. Okay, so since you have marked that one or mentioned that one as a problem area for you, I'm going to go on to the next one. Developing minor but consistent difficulties in your social functioning, meaning your work, school. Are you having difficulties in that area? Are you wanting to go to work? Are you not wanting to go to work?
No, I like to go to work.
You like to go to work?
Mm-hmm.
How about school?
Not so much, but I do it.
Not so much, but you do it. You're making yourself. Okay. And so you are able to follow through with those roles, right?
Yes.
And demonstrating significant improvement after having a period of difficulty. Are you doing better now than you were, say, a month ago, or a little bit better? Okay. So I am going to go down just because we do have the one area that you said that you have to really kind of force yourself to get out of bed. I am going to go down just to make sure that we're not in the moderate impairment level, okay? And in that, it says you're withdrawn, alienated, that you're having trouble in a lot of relationships, that, you know, are you wanting to interact with your family? Do you kind of isolate away from them, or?
No, I want to interact, but it's more of them coming to me not going to them.
They come to you, you don't go to them, okay. How about showering and doing that? Are you showering like you normally do, or are you having days in a row where you don't want to?
No, I shower like I normally do.
You shower like you normally do. Okay, how about sleep and diet? How's that going for you?
Sleep is good when it's good or not when it's not. So like I'll either sleep for long periods of time or very short. it's not like a consistent.
So you are having difficulties in sleep, right?
Yes.
Okay, so then where that is going to score you is at having a moderate impairment in your functioning level right now. Okay, so then what we are going to do is we're going to score that, add that number down. Moderate is in the 3. Okay, each category does give a number, and in each section there's a letter that goes with it. All right, and so now we're going to go to medical and addictive and co-occurring issues. Like, is there a reason for, like, not wanting to participate in your day, okay? All right, so no evidence of a medical illness. Do you have any illness right now, or substance use, or any disturbances related to anything like that? Do you have any medical issues? I know that you had told me that you had asthma. And
I have asthma, and then my heart
and your
problem.
heart problem. So that sometimes when your heart's not doing well, do you think that could make you a little bit sleepy? Are you taking medications for those right now?
Not right now.
Not right now. So okay. Have you ever used any type of substances? I know that you had said that you drink once in a while.
Occasionally. I don't make it a habit, but I don't medicate other than like my doctor prescribed like asthma medication or my heart monitoring, but that hasn't been for a while. So I try to do it more naturally, and it just doesn't seem to help.
Okay. All right. So you do have issues that should be monitored and should be medicated, but you don't like to take that medication?
Yes.
Okay. And so, like, you end up sick often because of it?
Yeah.
Or often as in once a month?
Once to twice a month.
Once to twice a month? Okay. All right. And so we have, and as far as the drinking, is it an ongoing or is it just episodic?
More episodic.
More episodic, okay. So where we're going to score you with that would be a 3A, meaning that you have a medical issue that needs to be monitored, but you don't follow through with that. And also 3D, because that's the episodic alcohol use, right? Okay, so your recovery environment, this next one goes about the stress in your environment. Essentially, is there like no stress, no problem at all? Life circumstances are completely fine and stable, or?
It's definitely month to month or paycheck to paycheck. Okay. Bills have to be paid, so I have to find a way to get those paid each month.
All right. And your relationships are all okay? Okay. Your living environment, does anybody pose a threat in your living environment?
No.
No? Okay. So, do you have any conflict at all with anyone right now?
No.
Would you say no? Okay. And is there anything that you would say is causing you distress, like with somebody leaving town, or concern about maintaining, like keeping, you said it was paycheck to paycheck. So do you think that would be maintaining your material well-being?
Can you elaborate a little bit more?
Like being able to keep your house, keep them,
It's definitely stressful.
It's definitely stressful.
Finding a way to make sure rent's paid, or this bill's paid, or that bill's paid. It definitely causes its own stress.
All right. So, okay. And then in that, then we do have, in a mildly stressful environment, that appears to be where you're falling, okay? So what I am going to read to you is a transition that requires adjustment, such as change in household members or a new job or school, okay? And you did tell me that your boyfriend has recently gone to play ball for a scholarship.
Yeah, and it's a long-distance relationship.
It's a long-distance relationship. That can be a little bit stressful.
Definitely.
So part of your support's not here?
Yeah.
Yeah. Okay. And then as far as, school and your job, all of that's about the same, or do you have a new job? Didn't you just tell me you started a new job?
Yeah, it's a new job, and it's hours are still working up, so it's still new and anxiety driven. For sure.
All right. So where you do fall in that is so far is that mildly stressful environment. We're just going to go down and check the next level just to make sure, okay, that there's nothing there, um, and that it is within that mild range. So family is all okay, right?
Mm-hmm.
Your transition in life, meaning that you have a job, you have no legal issues, and you haven't changed residences, correct?
Correct.
All right, so we are going to stay up there in that mild range on this one, and that would be a 2B. Then we're doing scores in that. And also, we have the alcohol issue, so we're going to add the E in there because not that you drink on a regular basis, but the alcohol is there a part of your life. Okay, now your level of support, and this talks about do you have supports and do you utilize them? Okay, so the next would be you have a highly supportive environment, that you're, say, in a living residential facility, and you have like a team wrapped around you. We know that you don't fall in there, right? Mm-hmm. Okay. All right, the next one is you have supportive resources, but they're not abundant. They're not. But they are capable and willing to provide support, and also that you have people willing to participate in treatment if you were to engage in treatment. Would you say that that's your level of support, or maybe less than that?
That would definitely be my level of support.
That would be your level of support. Okay, and so just to check to make sure that we're not in a more limited area, um, it says that you have some supports, but they're not capable, because you said that you do have them and they'd be willing. Would they be capable of showing up?
Being that I'm in a long distance relationship, probably not.
Probably not.
No, but I have like some family that would be able to, not drop of the hat kind of deal though.
Yeah, but they would be able to participate if we were able to set it up ahead of time.
Yeah.
So you kind of fall in between there. You have a supportive environment, some, but not really. So now we're down into that limited support, which means I have chosen, and it is the Smalley Institute Personality Test. The reason why I chose this test is that it does cover the person's strengths and what their weaknesses, along with when they're out of balance, how things can affect them. This test is a self-scoring test. The important part is that a person's honest when they're scoring this, and it doesn't ask about in a specific environment such as a work environment or when they're with their friends. It does talk about when they're with their family and how they interact with others though, and it asks them to score it, and that's where I see the weaknesses, is that sometimes maybe people aren't all the way honest, but for me it does give you a good insight as to how well you would work with others. And it talks about your rational strengths and the strengths when you're out of balance. Okay. So in the Smalley Institute personality test, it does cover your strengths, and it talks about your strengths, and it also talks about how those strengths, when you're out of balance and you're not doing well with yourself, how they can be interpreted and perceived by others. And so if a strength is that you're a good communicator and you take charge and you're a problem solver, when you're out of balance, that can appear to be bossy and controlling and cold-blooded. And so in this personality test, it also tells you the ways that you can, what you need to do to help yourself with that. And it'll tell you on there that, so your rational balance in that would be to soften a little bit and to take care of yourself a little some, so that you can become a good listener and hearing what the other person might need. The Smalley Institute personality test is a good test for yourself to learn and identify how you communicate, how you work with others, and how you can be perceived by others. Also in the Smalley personality test, it tells you, one, how you can work with other people, and also by having the other person or the other people that you're interacting with take that test, it shows you also their strengths and their weaknesses. And not necessarily is it a weakness, and how they put it on here is just the strength being out of balance. So when you know someone's out of balance, or they know that you're out of balance, it's not necessarily saying, okay, there's something wrong with them or there's something wrong with me, but it could be that there's something wrong with our communication together, and maybe we need to pay attention to that, and how working with others. How the personality test can be used when working with clients is when you know your communication style and when you know how you can be perceived. If you also do some of that personality test and have the clients take some of that questionnaire, I don't necessarily think that I would have them do that right off. I think that I would, have them in for a few sessions first, but at least giving them insight about themselves and how they communicate with the world, and then assisting them in identifying when they're out of balance, so that maybe they aren't being perceived in the wrong way, their interactions and their relationships can be better. I chose this test again because it does specifically point out how when you're out of balance and how you can pull that back in and soften, and areas that you can improve on, versus just this is how and who you are. It does relate it to, and the different, they talk about the lion, the otter, the golden retriever, and the beaver. I just want to show you 1 second. In the scoring here, it shows the bottom of, so maybe there's a couple that are really close together. Not all people are one personality type at all times. Sometimes you have one dominant and then you have another personality type that comes in when you're in with a different action of, say, a different type of environment. You're one type of person at work, and then when you're at home, you're another type of person. And those two people cross over and meet with each other. It's just, how do you become to keep yourself in balance and get to know who you are and the people, how you are when you interact with others. And again, how using it, say, like in a work environment, this personality test can be helpful and beneficial, because if you have a team and you need the team to be functional and working together, by knowing how your team members all work, you can pull the strengths of each team. And in the Smalley Institute personality test, it does tell you the strengths and where the strengths that you are in your communication style, and the things that you like to do. Okay. So with the locus behavioral assessment and the Smalley personality test, how the two would work together, I think in the beginning would be to know what your personality is and how you communicate and how you can help somebody communicate with you and get somebody to be able to feel comfortable enough to give you the information needed. And then later on down the line is by having the person take the personality test, and then you could then assist them into gaining and gathering the strengths and learning how to identify when they're out of balance and what they need to do to put their self back into balance, either to soften or to strengthen in certain particular areas, so that they can then relate and communicate out in the world at a better level, and within their relationships with other people at a better level. And then the locus also can be used in the behavioral assessment. You can redo that behavioral assessment periodically, say every 3 months, just to see how far the person has progressed, and do they still need the same level of support, or maybe we need to change supports.